Good evening, everyone, and welcome to Atp Live Monday. For those watching on Facebook, on Instagram, on YouTube, you're welcome. I know it's been a while you saw us on Monday because we've been celebrating our anniversary, but it's good to be back. So we're just going to quickly share the video. I'm going to share the video. Please share the video. Let's invite everyone to be part of ATP Live Monday. I'm going to share it. You can also help me to share as well. After that, we will start to take questions. But if you have any questions, feel free to drop your questions. Good evening. Nifemi, you're welcome. I'm just going to also share the video myself. Okay. Just going to share to our Facebook group so that everybody can see. Okay, so welcome everyone. Welcome. And I'm so happy that our Instagram is working today. Miss Debbie J, welcome. I've seen your question. Just give me a few minutes to post all the questions, to share our videos to all the groups and pin them, and then we can start. I'm really happy that we're able to stream to Instagram directly. It's giving me a headache for a while. Okay, I think we're in the groups also. So just to pin them in the groups and then we can start. Well, feel free to start dropping your questions. Thank you for all of you that have celebrated our anniversary with us. The whole of July has been so busy celebrating HTP at 10, and we really want to thank to those who celebrated, those who donated. Thank you so much. We are very grateful. We appreciate Wemi Industries for the generosity, and so many other people that don't want me to mention their names. Oh, thank you so much for being part of our story. Okay, so all right. I think I've done with all the sharing, and I think everybody can see me and they can hear me. So welcome everyone. Welcome to ATP Live Monday. I am Gbemi Boyd. I am a pediatrician, and it's my pleasure to welcome you to this program brought to you by Ask Pediatricians Foundation, where we get to answer any question that you may have about the health of your children, and try to educate parents, support you in raising healthy children. So we've been doing this for 10 years. So this year is actually our 10th anniversary. So we're so excited. And this program is just one of the programs where we do this. But beyond what we do online, we also do outreaches in communities. I think Lagos States were in one of the communities on Saturday, and so many other ones. I'm sure you've seen all our videos on our pages. So thank you so much, everyone, for being part of our ATP story. So if you have any questions, feel free to drop your questions. Start with the age of the child, start with the main concerns, and then you can ask your questions. So I think I'll start with Instagram because I think that's the very first question from Miss Debbie J. Good evening. What causes monthly coughs in toddlers? Okay, number one, we don't expect toddlers to have coughs monthly. Okay, we don't even expect them to have coughs every year. So, cough is not something toddlers should be having. So, when you make such a statement like what causes monthly coughs in toddlers, it gives the impression like it is something that all toddlers experience, but that is not true. Or rather, you personalize this kind of question like my own toddler is having coughs every month, what do you think is the cause? That is a neater way of asking it so that people don't go away with the impression that all toddlers are having coughs. So I know what you meant anyway, but I just want to correct that. So I don't want, because sometimes other people are listening and they sometimes carry away some lesson from other people's questions as well. So sometimes when people ask questions in that way, other people take it as, oh, is that a normal thing for all toddlers to have cough every month? This is not normal. It's not normal for them to have cough every month. Neither is it normal for them to have fever every month. Neither is it normal for them to have to be sick every month, like some people do ask. So number one, most toddlers do not have cough every month. So if your own toddler is having cough every month, we need to find out why and investigate. Okay, so there are conditions that can make a child to have recurrent cough, and usually one of the most common will be a child who is likely going to be asthmatic. Okay, unless there is something, for children who have some allergic conditions as well, like when they are exposed to that particular thing, then they will start to cough. So each time they get exposed, they will cough. But usually when you see something happening recurrently, the first thing we have to think about is this something allergic, because usually things that are like infections and those tends to, they will happen, you treat it, or it will go away. Though sometimes for children who goes to daycares and all that, because they tend to have exposure to the same kind of children, it's like a vicious cycle. So one child is coughing and then your child is exposed. By the time that child is getting better, then this other child will start coughing, and then by the time they are getting better, they've exposed the other children, so it becomes a vicious cycle. That can also happen in that scenario where the children are always having cough. And the way you know is that those kind of children, when they are not in the daycare or when they're on holidays, you find out that they don't really have that cough anymore because it is the exposure to other children coughing. But if it's not from nursery or school, and then the child is coughing every month, especially for children who cough maybe at a particular time of the day, some will say the child is always coughing in the night and all that, then we tend to think of something allergic. Bronchial asthma. Some children also have what we call postnasal drip. So children who have some kind of obstruction on their airway, like adenoids and stuff, they can also have some irritation along their throats in the night. So, and that can also make them to cough more at night. So it is now basically summary. It is not normal for a child to be coughing every month. If your child is coughing every month, we want you to bring the child to us, see a pediatrician. We will ask you several questions to narrow down the specific cause. Sometimes we even need to do chest x-ray, because there are other causes of chronic cough, but that will not be like every month. That cough will be there all the time. So children who have tuberculosis, children who have heart condition, they will cough all the time. It won't be monthly. They will be coughing all the time. So we may need to do those kind of investigations to find out why is your child coughing, and then that will tell us what to do. So the solution, like some parents always ask, oh, I've given cough syrup. The solution is not always not cough syrup for children who are coughing. The solution is for us to know why is this child coughing, and then we can deal with it. I hope that is helpful for Miss Debbie J. If you're still listening, just let me know you got the answer to that. All right, let's come back to Facebook. Abdul Karim Wuraola, good evening, ma. How do one correct a 1 year old without sparking her? Okay, I really want to try gentle parenting. Thank you so much. That's a very honest and very a sincere question from your parents. Okay, now I do comments about, pediatricians, typically that's not our job, but we have to, because we are the advocates for children, so we handle parenting, even though it's not strictly speaking health issues, but as the advocates for these children who cannot speak for themselves. We have to sometimes come out and defend our children. Now, one thing parents need to understand, we need to understand what we call the development of the brain of the child. Most of us, we treat our children, our infants, our toddlers, we treat them like adults. We treat them like teenagers. They are not. You need to understand what a 1 year old understands, what a 2 year old understands, and what a 3 year old understands. We need to understand what we call developmental progress in children. If you understand that, then you will know how to parent our children. So there are parenting courses, so I'm not going to attempt to do all parenting class in this 1 hour that I have. A 1 year old does not understand the concept of consequence. Like, you, a 1 year old does something and you beat that child does not understand in their brain why you are beating them. That is the truth. They don't. So they don't understand. That's why you see, like, you beat them, and that's some of you always express that frustration, and you beat the child and the child still continues. The child doesn't even understand why you're beating them because their brain is not mature to that level. They don't appreciate that consequence, that cause and effect. Then it's not yet developed in a 1 year old brain. So beating a 1 year old for doing something, you are just hurting the child. It's the child abuse because that child doesn't even understand why you're doing what you're doing. And this is the time that the child is developing what we call attachment. So they need to understand that you are there for them and you're there to support them, you love them. That's not the time that you are confusing them by eating them. And that is why some of the children start to eat other people as well, because they think you eating them is maybe your way of showing them love, and that means it's okay for them to eat other children as well. And that is why so when you see 1 year old, 2 year old eating other children, most of the time somebody is eating them at home as well. Like a mother was asking me the other day, my child is biting me, so, and I or biting other people, then I bite the child back. And I'm like, how does that make sense? You're trying to stop a child from doing something, but you're also doing it to the child. Then the child is going to continue because the child will think that is normal. Okay, so at that age, children 1 year old do not understand. When you tell them not to do something and they do something, they don't even understand. That's what why you're beating them or why you're causing all that. What you need to do in that age group is remove her from situation. Okay, if a child is doing something wrong, you take them away from that situation. You can take them to a place where that particular, for example, let's say a child is touching something, you don't want them to, you take the child away from that situation. You can also use what we call distraction. You give them an alternative that is what you want. So you tell them what you want. Most of the time we tell children what not to do. They don't understand that what we need to tell them is what we want them to do. So we show them the positive thing we want them to do. We give them the positive alternative we want them to do. Rather than shouting, rather than beating them, they don't understand. That brain maturity of seeing cause and effect is something that develops between the age of 3 to 4. And that is when you begin to now use consequences. And then that's when you begin to tell them, if you do this, you will lose this privilege, or you're going to, and then use something that is age appropriate. For example, some people use timeout, and timeout is have to be proportional to the age of the child. So we say 1 minute by the age of the child. So those are some of the strategies. So there are a lot of positive parenting classes and books and strategies. I will recommend you to read them. And more importantly, I want you to recommend what we call child development. Understand what is appropriate for each child to do. I've seen a mother was telling me that a child, a 2 year old or 1 and a half year, is touching her breast and she's beating the child. That doesn't make sense. That is normal for a child to do. A child who is just breastfeeding or who just suddenly stop breastfeeding, it is normal for them to touch the breast. You are the one thinking, oh, maybe it's something because of what your own brain is thinking as an adult, that's a private part, and the child touching it means, it's not to it. That child doesn't understand that. It's the same thing like children touching their body parts. At that age, children have what we call the sensory neural, stage, sensory motor, where everything they feel it through their mouth or through their hands. So that's why everything the children you give to them, they put it in their mouth. That is the age for them to do that. So that is why what you need to do is to make sure you don't give them something that is dangerous for them to put in their mouth. So we need to understand that different stages. Then there's a stage what we call concrete. So when you take something away from children, that thing has disappeared. They don't know that thing is still existing. Then they go to the stage where you have what we call abstract thinking. That is when they know that even though you take something away from them, that thing is still existing, even though they don't say it. So there's a lot we need to understand. And I know, unfortunately, children don't come with a manual for us as parents. So we don't have the manual. But these days of AI and these days of technology, knowledge, we have no excuse for not knowing all these things. So when we understand this, then we will understand the parenting. So those days where we're just beating children, hurting them, for what they don't even understand why you're hurting them for, is not something we should be doing as parents. So we should endeavor to understand what our children can do at this age and at that age, and then we can. So a 1 year old being spanked is child abuse. A 1 year old doesn't even understand what they have done. They can't even understand that. You can't have that conversation with them. This child is barely learning to speak one word, and that is the one word they understand. They understand mommy, daddy, maybe biscuit, maybe 5 words. So how can you even have a conversation with that child? And how does you beating that child make the child to correct themselves? They are not. So that is not appropriate. So I will stop there because we can, like I said, we can do a whole course on parenting, but we have loads of resources on Ask Pediatricians on parenting. We've invited parenting experts and they've come to give us lectures. I will encourage you to listen to them or just go online. There are lots of free parenting classes, free parenting resources, parenting books for you to buy. 1,000. I think there was that we're putting in our group. Is it 1,000 rules of parenting, 100 rules of parenting? I can't remember now, but so those kind of things you should be reading them. Positive parenting. What are the alternatives? Read those kind of things. Raise your children with love. Raise them. We're not saying you should not discipline, but discipline is not when we are beating children and hurting them. That is not parent. That is not discipline. Discipline is when children you parent the child according to their understanding, and you let them understand this. And when they get to the age where they understand consequence and all that privileges, that is what parenting is all about. So I hope that's helpful for Worola. So please don't beat our infants. It's child abuse, and in places where things work, we're going to come take the child away from you. But I know you won't do that. Okay. All right, let's go back to Instagram. Miss Debbie okay, thank you. Thank you for the correction. We have seen many pediatricians and also so what did they tell you? Okay, yes, allergies. It is mostly infection, and it had tonsillitis. Okay, so if have you seen the ENT doctor? So if your child is having tonsillitis, you didn't really tell. You've done X-ray, but you didn't tell me whether they are enlarged adenoids or tonsils. The reason why I'm asking that is if your child is having recurrent tonsillitis from the enlarged adenoids and tonsils, the solution is that we have to take them out. If your child is having more than 6 episodes of the tonsillitis, of that cough, and having infection every month, which is what you are saying, we need to take out the adenoids and the tonsils. That is the solution. That is one of the reasons for surgery, recurrent infection, which is what you are trying to tell me in a way. So your child has been having recurrent tonsillitis, having this cough every month. And each time you go to the hospital, it's always coming as infection. Then the solution or the final solution is to take them out. So I will recommend, I don't know whether your pediatricians have referred you to see the ENT doctors. That is the next step. So they should refer you to see our ENT doctors, and the ENT doctors will tell you whether they are going to do surgery. I know a lot of parents don't like surgery in children, but usually for children with recurrent tonsillitis, adenoids, enlargement, recurrent infection, that's the final solution. It's usually a day case, and most children tolerate it well. So please see the ENT doctors for the next step. All right. Odnifemi. Okay. He said my baby is 7 weeks old. I noticed that she's collected 6 weeks immunization. She have really changed. Okay. She cries a lot for no reason. I took her back to the center Temperature was 38.6. They run some tests. She said she has malaria. She was given injection. Why was she given injection? Can we just normalize treating children even if they have malaria without injections? The number of times, and health centers especially, it worries me how many health centers are giving injections. They are not even authorized to do that. Injection for malaria, as malaria treatment that involve injections, are reserved for severe malaria. And I'm saying this because I want you parents to know what to take. I don't know why we all have very injection how would I call it now? Like we always want to accept injections in children. In a 6-week old, for crying out loud, we should be giving injections to a 6 weeks old for malaria. I didn't hear you say this child is vomiting, so why should the child be given injections? Injections for malaria treatment is only if a child has what we call severe malaria. So all this one, we're always going to hospital. This child is walking, this child is eating, this child is not vomiting, and they're giving our children malaria injection. It is wrong. We should stop taking injections. And then the next day, everybody is coming to ask, oh, my child is not walking, my child is limping. Why wouldn't they limp? Because they keep giving them injections and causing traumatic neuritis. And these injections are not even acceptable. It's not, but we have a treatment guideline for malaria, which everybody has in Nigeria. You can Google it, it's available online. Okay, go and read how should malaria be treated. So don't say, oh, it's what doctor. No. So if your doctor is doing the wrong thing, you can tell them, doctor, I've read it online, this is how malaria should be treated. No child should be given malaria injections if they do not have severe malaria. And when the child has severe malaria, the child is very sick, the child needs hospital admission. Any child that has severe malaria is going to be admitted. It's not a child that is going home that day. That child is going to sleep in the hospital. This is a child that has fever, malaria with convulsions, or malaria with very severe low blood level, or malaria with yellow eyes, or malaria with what we call cerebral malaria. They are convulsing or they are unconscious. Those are the children we treat with injections for malaria. Not all these our children that are walking up and down, that are drinking, that are eating, and we're always taking injections for them. Please don't take it, because you also have a right to say, I'm not going to take injections. So I know that I should also speak to my colleagues, but at least I think I should also speak to the parents. Okay, so please, when you go to the hospital, if your child is not vomiting, don't take injection for malaria. And I mean that, and I'm saying it with all sense of seriousness and responsibility. It is wrong. It is poor management. But almost everybody in Lagos and Nigeria is taking injections for malaria. You shouldn't be taking injections for malaria. You should only be taking injection for malaria if your child has severe malaria. And that means that child is going to die, really. That is what it means, severe malaria. So those are the kind of, and usually we admit those kind of children, they are very sick. We keep them in the hospital. You're not going home immediately. You are going home, you are staying in the hospital 1, 2, 3 days. So those are the kind of children we give injections or we give IV. But most of these children that are, working with you to the hospital and fully conscious and talking and eating, they should not be taking injections for malaria. That is wrong. Okay. So if that's the only thing anybody will take home today, please just take it home. And anytime they offer your child injections again for anything, don't take it. If they're not keeping your child in the hospital, don't take injections. It means your child does not need any injection. Your child should take the drugs by mouth. Okay, it doesn't add any extra thing. And you said that, okay, they were giving your child injection, they gave medicine, but you've not given her. What should I give her? I can't answer that question because I'm not the one treating your child, and that's a very medical legal kind of question. You've been to the hospital. The people who saw your child is the one treating your child. They have the responsibility of care. I can only advise you based on what I just advised you now, that I don't expect them to have given your baby injections. Okay, for babies that are very small, 6 weeks old, 8 weeks old, please don't take them to health center when they are sick. Take them to hospital that has a doctor, that has a pediatrician, please. Because it's not everybody that can treat very small babies. Small babies less than 2 months old, don't take them to health center when they are sick. Take them to health center for your immunization. Take them to health center for your weights and heights and all those stuff, vitamin A and all that. But for illness, take them to a hospital that has a doctor, preferably a pediatrician, because if you've seen a doctor and they're giving you drugs for your child, it is wrong for another doctor to tell you your child should not take those drugs. I have not seen your child, so I can't take responsibility for saying this is how your child should be treated, or this is not how your child should be treated. So if you have doubts about the people you've seen and the way they're treating your child, you have to go see a doctor for a second opinion, which I'm not able to give. I can only give you a second opinion about treatment if I have seen the child myself and made my own assessment. I can only comment on certain things, for example, like why are they giving this child injection? So those are the kind of things. But you really need, if you are not happy and you're worried about your baby is still very small, it's a 6 weeks old, please take this child to a general hospital or a teaching hospital and see a pediatrician. Okay, there are some babies that even I don't feel comfortable with a general uh, practitioner, a GP treating them. Those kind of babies should be treated by a pediatrician. Those are the people that should treat small babies, especially when you have concerns. This 38.6 temperature is very unlikely to be from the immunization. You took immunization last week Tuesday. Today is Monday, so it's over a week. Very unlikely to be immunization. Very unlikely something else is going on, because you're also saying the child is changing and all that. I don't know whether that is just part of the normal 6 weeks old baby cry a lot, they do all that. But if you're worried there is more going on with this baby, I really want you to see this a pediatrician, and that is the right thing to do. Sorry about that, but unfortunately, I won't be able to say do this or don't do that. No, I don't even know which drugs you're going to give. They gave you, so how can I say give it or don't give it? Like, you've not even told me the names of the drugs that you're supposed to give to your child. So it's not a fair question to ask another doctor, and also you ask a lot of medical legal implication, which we are unable to take responsibility for. If I've seen your child, then I can answer that kind of a question. Okay, somebody saying, what is the possible treatment for colic? Colic in babies is something that will come and go. Most of them don't need any treatments. And that is, hopefully you're making the right assumption about colic, because a lot of parents call everything colic and may not necessarily be colic. But colic basically is a baby who is crying for no reason, but the child is otherwise well. And yeah, so that we know, we are not sure why. Sometimes we think maybe there's a release of gas. Sometimes when they are passing through urine, they cry. But the good thing about colic is that children tend to outgrow it. So usually we just say comfort them. Some children like it when you carry them, when you bounce them, when you move. Some children like white noises and all that. If the child is a little bit very gassy, sometimes we give things like Simethicone, that is what's it called? What's the name now? Infacol. Yeah, so we give things like that to help, but sometimes it may not help some children. But the good news is that by the age of 3 months, most babies will stop having colic. So you can read about colic on our websites, and you can see all those um strategies you can use, or you can just read about it online. But the good news is that most babies will stop having colic with time, so you don't need to worry yourself. Keep breastfeeding your baby, avoid them crying too much and taking a lot of gas and hair, because that will also make it worse. So we also try to run away from bottle feeding, because some bottles, unless you're using anti-colic bottles, some bottles also make the children suck in a lot of gas and can also make them colicky. So you just avoid, but the truth is most colic will resolve on their own without you doing anything or doing much. So just hang in there. It shall come to pass. Okay. Ifama Agbasi. Okay, my baby of 4 months after taking. Okay, your baby is the one that's taking clonazepam. The doctor have said to tell her, okay, because of the shaking her leg. Okay. Which I uploaded the video in the group but stopped. Okay. Is there anything I need to look out for? I don't know. I don't think there's. It's just the doctor that is telling up the medication should be following up the baby. So the doctor will follow up your baby. Of course, if you notice anything again, you should see the doctors. But there's nothing in particular I would say look out for. But if you notice anything unusual, any abnormal movements, any other issues, then you should please see the pediatrician that is following up your baby. I can't remember all the details now. Did you do an EEG? Was the EEG normal? I can't remember all the. Because I remember this issue, and I said that we will not start the baby on clonazepam for benign sleep myoclonus, which that's the part I remember. We usually will not use clonazepam. That's a very strong anti-epileptic drug for us to use for just benign sleep myoclonus. So I don't know whether you made mention of EEG and whether it was confirmed your baby has epilepsy or not. Anyway, but I'm happy you're seeing a pediatrician. And so I will leave my colleague to conclude, to continue with the work they are doing. Right. Good evening, Doc from Kenya. Oh, Christy, thank you so much for joining us all the way from Kenya. How long should vaccine fever last? Okay, how long? Okay, number one, it is not compulsory for a child to have fever after taking vaccine, because I get a lot of um, question about people who actually were surprised or they were worried that the child does not have fever after taking the vaccines. It is not compulsory for your child to have fever after taking vaccine. So that's the first thing I always like to clarify. So it's perfectly normal for a child to take vaccine and not have fever. That is number one. Number two, some children can have fever, so it is a common side effect. I think it's the commonest side effect of vaccines. There's nothing to need to panic. Usually, we would just say give them paracetamol or ibuprofen for at least 2 days. So, and when we say give it, we say give it regularly, like you give it every 6 hours for 2 days. And usually by then we expect it to have resolved. So I would say within 2 days, most fever due to vaccines side effects should be cleared. So if your child is still having high fever and anything else, you have to come and see us at the hospital. Most children within 2 days, the fever should have resolved. I hope that's helpful. You started taking malaria vaccine in Kenya. That's good. I'm not sure whether we've started rolling it out in Nigeria as well, but I'm not sure we have covered everywhere yet. So hopefully we will get very close to Kenya as well. Let's move on. My baby was fine. Okay, yeah, Nifemi, my baby was fine before immunization. I only went there because of the temperature. Now she cries a lot. When you say her sleeping pattern have changed, what's changed? Is the child sleeping more? How many hours is the child sleeping? Just tell us, because baby sleeping pattern is not consistent even in this age group. So in this age group, they tend to sleep more during the day and awake more during the night. They sleep several hours. So, and we know it's going to change anyway. Sleeping pattern is going to change in newborn babies. So that is not something I will worry about. So you need to be more specific when you say the sleeping pattern have changed. You need to tell us exactly what changed. And usually, for if you have seen me, if your child has taken immunization and having fever, but I would say I hope you were given the paracetamol consistently within 2 to 3 days. And then you need to check that site of the immunization. Is there any swelling? Is it red? Is it hot? Any pulse inside? Those are the kind of things we check. Of course, they've also checked for malaria. So which plus or minus, I'm not sure whether it's malaria causing a fever. So, but you need to give us more information about this sleeping pattern that you keep saying it has changed. So if your child has been confirmed to have malaria, then you should continue the treatment for the malaria. So you didn't tell us what medication they gave your child, so it's difficult for us to give you advice, which is why I'm saying that if you are really worried, because I always take parents' intuition very seriously in small babies. Small babies don't always show a lot of signs. They don't always show a lot of signs, and they can be very sick without showing much signs. And it could be as simple as mother thinking, my baby is different, my baby has changed, which is what you keep saying, which is why I'm actually worried about your baby. So because sometimes mother just notices something is just not right with this baby, and baby may not actually have a lot of signs. So usually that is why I would say I will be more comfortable if you see a pediatrician. So go to a general hospital, go to a teaching hospital. Most of us will never turn back a 6 weeks old baby or a 7 weeks old baby, no matter what. So go to any of those kind of hospitals that have pediatricians and see a pediatrician. Even if you see the pediatrician now say everything is fine, do this, do that, I will be more comfortable. I will sleep better at night knowing that a more senior doctor for children has seen that child. Because sometimes I know it's difficult to explain. Sometimes parents are not able to put it into words, but they know enough that this child is different. And I will worry about that in a baby who is very small because, like I said, babies less than 2 months old, even just the fact that they look different or they see anything change in them, it could just be enough to set off a lot of alarm bells for us as pediatricians. So I'm more comfortable if you see, because obviously I think you are also not comfortable with the treatment you got at the health center. You seem not comfortable, which is why you are asking whether you should do something or not. Because obviously, if you are comfortable with it, you would have done it. You don't need to ask us. So the fact that you're not comfortable and you're not happy with your baby's presentation, I will recommend. My recommendation is that let's take this baby to see a pediatrician in any of our, I don't know which part of the country you are, but go to the nearest general hospital, go to the nearest teaching hospital. They always will have a pediatrician, and then they can see the baby. If they are happy with what you've been given, then they will tell you to continue. If they are not, then they will tell you what next to do. But I understand your concern as a mom, and I always take it as a valid concern in this age group. So I want to see one of my colleagues and take it off from there. Okay, Olarunshola Kenny Caroline, good evening. Please, after 1 year, 6 months immunization, is there still routine immunization? Yes, there is. Let me see whether I still have my immunization schedule. Let me see if I can show you that. There is, we immunization keeps changing every year and we keep adding more to it. So I'm not sure whether you can see that. It may be a little bit tiny on your screen, but if you go to our Facebook group, you will see a bigger version. So this is our current immunization schedule in Nigeria. And you will see that there is something after 18 months. There's actually something at 9 years. So we are now giving the HPV vaccine. So there's a long gap, I know, between the 18 months. But before even that 9 years one, the vitamin A, you should be getting, it's not strictly speaking immunization, but we want you to take vitamin A up to the age of 5 years, every 6 months up to the age of 5 years. So there's still something. And then at 9 years, we are now giving the human papilloma virus vaccine, HPV vaccine, is now available for the boys and the girls from age of 9, is it 9 to 10 years? Some people give it as early as 7 years old. So, but I think in Nigeria we said 9 years. So don't forget it, because I know it's very easy for us to forget, because after 18 months is a long break. But there is HPV vaccine which will protect our girls from cervical cancers and protect the boys as well. So we need to make sure we get that particular immunization. And I'll just say keep your eyes open, because immunization is something that we keep adding every day. Not every day, no, maybe every few years. Let me not exaggerate. Okay, so because there are vaccines that we don't even give now. I remember when I started asking pediatricians 10 years ago, rotavirus was not part of your immunization. Pneumococcal, you have to pay for it. People were paying 20,000 naira for Previna that time. Which other vaccine? I think there was a time hepatitis B was even not part that we have to pay for it. So, but over the last 10 years now, so Rota is now free and it's part of our immunization schedule. Prevena, pneumococcal vaccine is now part. We're not even giving meningococcal vaccine as well. That time too, you have to pay for the meningitis vaccine, which is now free, and we give it to you at 9 months. So things change. So just keep your eyes open. And now we've added HPV. Now we are adding malaria vaccine. Malaria vaccine is being rolled out, but it's going to be part of that schedule soon. We are advocating for the booster doses for diphtheria and tetanus to be given to our children at the age of 18 months and 5 years. It is not yet passed. So there are many vaccines. Even chickenpox vaccines is not yet passed, but it's another vaccine that we can add. So don't be surprised that maybe in a couple of years we may add more vaccines. Definitely malaria vaccine is going to be added. It's already in the pipeline. Maybe a couple other more, maybe the booster doses for diphtheria, because we're not having diphtheria outbreaks. So we're going to be adding more. So it doesn't end at 18 months. Even though we say the Nigerian schedule ends at 18 months before, it's no longer 18 months. Before it used to be 9 months. Now we've made it 15 months. It's actually 15 months, not 18 months. The last dose is at 15 months. That is Mrs. 2. And now we're having HPV, which is at 9 years. We will likely had booster doses somewhere. We likely had malaria doses somewhere. So just be on the lookout for the extra vaccines. But I'm sure we will, just if you keep following people like ATP, we will always let you know whenever we have new additions to our schedule. So just be on the lookout. And these days we can set reminders on our phone so we don't forget. All of us are using smartphones. That's one of the benefits of using smartphones. So let's remember to set those alarms. Instagram people ask questions. I can't send questions on Instagram, but I can see you there. It's fine. Okay, the next question, Ifama, she had this brief shake in her leg. After she starts sleeping. Ifama, your question, you've already gone beyond this stage. Your question is your home is a different scenario because the issue here is whether your baby is just having sleep myoclonus or epilepsy, and you're already being treated as a child who has epilepsy. So it's not this we have gone beyond this stage because you already have a pediatrician who is treating your child. So I will leave it to the pediatrician to continue. Obviously, they've started telling her of the medication, which is absolutely lovely if they are happy with it. So I'm not sure what your doctor saw that made them start medication, but like I told you, they don't just start those kind of medications out of the blue. It's not something a pediatrician will just start without having very strong conviction for starting it. So I have not seen your baby. I have not seen your baby's EEG and all that. So I'm not going to. I will defer to somebody who is actually seeing your baby to. So I will let them continue to do the right thing with your baby. All right. So let's just leave it at that. Ifemi says she sleep less in hours in the day, less hours, like 2 hour max, and the night she sleep only 4 hours. Malaria medicines, Katef. What is Katef? I'm not sure I know what is Katef. Must be a trade name I'm not familiar with. Anyway, yeah, all those sleeping time is not really, I won't worry about that. Okay, Katef is artemether lumefantrine. Okay. Yeah. So usually when children are not well, their sleep pattern will be affected. That is not, I'm not particularly worried about it. The hospital are on strike. Which hospital are on strike? Is hospitals on strike in Lagos? I'm not aware of that. Are you sure? Let me check. Is it Lagos State Hospital or the general hospitals on strike? Anyway, even when hospitals are on strike, our emergency room will run. That one. Okay, so the medical guild. Okay, so Lagos State Hospital are on strike. Okay, go to the federal hospitals. Okay, I just confirmed that the general hospitals in Lagos on strike, but the teaching hospitals will be working. The federal medical centers will be working. So there's Federal Medical Center, Busemeta. There is Lagos University Teaching Hospital, Lux. And you can also do private. There are private hospitals that have pediatricians, so you can go to any of them. You don't have to go to a government hospitals, so that's fine. Sorry about that. But it's better to just let them see your baby. So, and even for those hospitals on strike, I'm sure the emergency room will run. The emergency services will always run, so no problem about that. Okay, how do I handle my 2-year-old who likes crying and throwing tantrums about everything? That is what we call terrible too. It's normal for 2-year-olds to throw tantrums. There's nothing wrong with that. That's part of being a 2-year-old. Even when it's one causing problems and making troubles, yeah. So it's one of those things for 2-year-olds. So at this age, you can again remove them from the situation, and then you can give them time out. You can get them to sit 2 minutes on the stairs or 2 minutes in their room. I know the issue is that most time when the children are crying, we as parents, we tend to get upset with the loud noises and the crying, and we always want to intervene. Sometimes it's also okay for them to just let it out of their system. You don't always have to stop them from crying and all that. You just give them space to deal with it. But it is one of those things you're going to get in 2 year olds. 2 year olds are the age where they are beginning to recognize what we call independence and autonomy. So a 2 year old is beginning to feel like, yes, I am an adult. So if you like, they are now beginning to recognize that they are actually a separate human being from you as the mother. Whereas the babies, they're always on you, they're always completely dependent on you. A 2 year old is beginning to recognize their independence, and they're beginning to assert themselves, and they begin to exhibit their will. So they have a lot of will. They always want to do what they want, which can be positive. So we don't want to break their will, but we want them to exercise their will in a positive direction. So again, all those parenting classes I mentioned will come into stage. So the easiest way for those kind of children is distraction. Don't try and always force them to change. Give them an alternative that may be more interesting to them. Sometimes you just need to give them a hug instead of trying to always make it right or tell them they are right or wrong. Sometimes they just need a hug. Sometimes they just need a drink. Sometimes they're just hungry. Sometimes they just need for you to give them something else to play with that is more interesting. So you need to know how to pick your battles with those age group. They don't understand yet all those explanations. They don't remember their age. Their language is just 2 words, phrases. At a 2 year old, sometimes I see parents talking. We talk so much, plenty grammar. To a 2 year old, the child doesn't understand all you've said. They can only understand 2 words, phrases. So don't try to explain and give commands and stuff like that. Take them away from the situation. Give them something alternative. Give them a break. Let them just have a break and calm down on their own. And sometimes you just want to sleep. So it's part of your own um part of parenting to now begin to figure out, is it this child just tired? Is it that the child just needs to eat? Is it that the child just needs a break? Does the child need to go sleep? It takes a little bit of time to figure out, but good news is that they don't stay in that stage forever, and they'll begin to grow. And but I think what we normally try to do most time is try to talk to them and talk long and shout and threaten. It doesn't work because they don't even understand half of what you're saying, because their language development is not even at that level. So that's why I keep saying distraction, take them away from situation, give them alternatives, make sure they are not hungry, make sure they are not tired, make sure they're not feeling sleepy and all that. And that's it. And hopefully as they get older, some of those things will fade away. So it is usually typical at this age. In 2 year old, we expect that, and that is perfectly normal. There's nothing wrong with them. Okay, since today is parenting class, maybe we'll revisit one of our parenting courses again and bring one of the parenting. I'm not a parenting expert, I'm a pediatrician, but because as pediatricians, we have to deal with parents and the children, so we also have to have some of these skills as well. Bolowatife, my baby of 3.5 months had bacterial infections a month ago. So your baby had it when baby was 2.5 months. Went to the hospital, given antibiotics. Infection has cleared, but it's back again. How do you know it's back again? Okay, boils. Okay, if your child is having recurrent boils, the question is, how is the hygiene around the baby? Because most of the time boils are bacterial skin infection, and they are from the hands of those who are touching the baby. So prevention. You must wash your hands. Some of us just, we've gone everywhere, go to the kitchen, go to the bathroom, go to the toilet, and we just come back, mom, carry the baby like that. No, please, let's learn to wash our hands. Let's just use hand sanitizer. We have to pay attention to hygiene a lot around the baby, even the surfaces where we keep our baby. Sometimes you need to wipe them. I always say for babies, don't just put them on any surface. Put the baby blankets or mat first before you put them down, because obviously your baby stuff are likely going to be cleaner than that is just there, and because they are still young and their immune system is still growing, so you need to make extra effort to keep them away from germs. So hand washing, remember COVID, you remember we're washing our hands so obsessively during COVID? Sometimes that is what we need to do for the babies as well, because they are still very young and the immune system is still developing, so we have to make extra effort. Okay, if your baby has infection, you see your pediatrician, the pediatrician has prescribed another antibiotics. Yes, you have to use it. You have to use it because you have to clear the infection that is there. That is number one. So that's why the doctor is prescribing the antibiotics. But more than just clearing the infection, prevention is key. So please pay attention. And it may not even just be you, it may be other people. All of us, some people, all of us, anybody just come, boom, they carry baby. Most of them, you don't know where they are coming from. You don't know what they've touched their hand. So I know it's not, most of us, especially in this part of the world, I'm sure you're Yoruba now, so it's cultural for us to allow everybody to carry your baby, but usually you should tell them to wash their hands before they touch the baby. I know. And I'll give them hand sanitizer. I go to people's home to visit, and I'm a pediatrician, and everybody always wants the pediatrician to carry the baby. And I always want I need to wash my hands first, even me. So, but people don't ask me like that. They just want to dump the baby on my hands, and I always say, please let me have the hand sanitizer, let me have something first, let me wash my hands. So we should always do that, so that even the siblings, all of them, they've gone to play, and then the next thing, they want to come and touch baby, they want to carry baby, they want, it's nice for them to show affection, but hygiene, hand washing, very key, because that is where all those boils are coming from. Even the soap, I will prefer for babies use liquid soap, but if you're using bath soap, make sure that where you keep it is dry, so that it doesn't generate a lot of bacteria, doesn't grow underneath it. The sponge, make sure you dry them thoroughly. The towels, you wash it regularly, and make sure it's sun dried, and make sure it's ironed, because those are where the germs are coming from. So I know you may be doing some of this, but for babies, you have to go extra mile to keep germs away from them. We have to go the extra mile. As they get older, they too, their bodies are now able to deal with those germs easier. But in this early phase, we have to make more effort to keep them away from germs. I can't say Instagram people, no question. Okay. If you have had question before on Instagram and maybe it ran off before I answered it, please feel free to ask again, because I may have mixed it. Okay. Queen Esther, oh, what's her name? My 7-month-old has refused to eat after 6 months exclusive breastfeeding. I know if I don't get this kind of a question in a day, then it is not yet ATP. Because this is the most frequently asked question ever by mothers to pediatricians. My baby is not eating. And when mothers come with this question and say, my baby, I've done exclusive breastfeeding and maybe I refused to eat, they are kind of trying to blame the pediatrician or indict us for the baby not eating after the exclusive breastfeeding. It is not true. Let me just tell you that one. Your baby not eating after you after the exclusive breastfeeding is not because of breastfeeding. In fact, what research has shown is that babies who are exclusive breastfed are more likely to take to complementary feeds, because they have been tasting all those food in your breast milk, all the yam, all the eba, all the vegetable you've been eating. Your baby, they've been tasting it in your breast milk. So I understand when people start with this premise, but it is not breastfeeding that is a problem. Most of the time, it is the fact that we don't understand how to go about complementary feeding. Okay, so and this baby's weight is actually overweight. Your baby's already overweight. The baby was big anyway. Baby was 4 kilos at birth, but baby's weighing 9 kilos at 7 months. That is too much. Baby should be weighing 9 kilos at 9 months. But then your baby has always been big, so I hope there's no health issues. Sometimes it's just natural if you are very big, your family and all that. But usually when we see babies who are very big, we also want to be sure there's nothing health-wise wrong. So that's just on the side. So your baby should not be on breast milk and water. That is recipe for malnutrition, though your baby already has a lot of reserve anyway. But this baby needs to be taking complementary feeds. So I want you to, I don't know whether you've gone through our guide session, whether you've done our videos on how to go about complementary feeding. And I think most of the time, most of us are just so eager. We want the babies to just jump from breast milk to eating everything we offer them. And some of us even give too much of the complementary feeds, because we kind of translate the milk, the quantity they take as breast milk, we translate it the same quantity as solid. No, the quantity they need to take as solid is actually much, much smaller than the quantity they take as milk, because there's more calories in a smaller quantity of solid than in a large volume of milk. Okay, so when you're starting complementary feeding, you keep breastfeeding your baby and then you give solids, and you only give water when your baby has taken solids. So if your baby is just taking breast milk, you should not be giving water. Water is not giving the baby calories, and water is actually diluting the calories in the breast milk. So the baby's tummy is full, but it's full of 0 calories. So baby may start to lose weight. So you are lucky your baby has gained so much weight during the period of exclusive breastfeeding. But if you don't start to do the right thing now, baby will start to lose that weight. Okay. So your baby should take other food solid. If your baby takes solid, then you can give them water to drink. But baby should not be just be drinking breast milk and water. Water is giving baby 0 calories. Okay. And we have videos that show you how to go about complementary feeding. Complementary feeding is the food in your kitchen, and of course you start with what we call, either like porridge like, and then mashed, and then before you go to full solid. The quantities they need to take at 6-7 months is just twice a day. The most of their food is still breast milk, and when you start, sometimes it's just 1 spoon. That is fine. The fact that your baby did not take 3 spoons day one does not mean the baby is not going to take that food, because that is what most mothers do. You give them 20 or 50 minutes, 100 minutes of pap, and they didn't take it. That means the baby is not taking pap. That is not true. When you want to start complementary feeding, is gradually. So if the day one baby take 1 spoon, that is perfect. Then day two, baby can take 3 spoons. That is perfect. Then you move on to 5 spoons. That is how we increase. And also make sure the food you are giving the baby is tasty, is colorful, and it looks presentable. And please don't use bottle to give complementary food. These are small things that parents don't pay attention to, and these are the issues, reason why babies struggle with feeding and all. And then we're always so impatient. I always say be patient, be persistent, so and then you will get there. So you have to keep offering. For example, we say if you have not offered a baby food 13 times, that is 3 times, you cannot say that baby has rejected food. So I get a lot of questions from mothers telling me their 6 months old have rejected all food. Immediately I see that question, I know this mother doesn't even know what complementary feeding is, because there is no way a 6 month old would have rejected all food. There is no way you would have tried all food in a 6 months. Your 6 months old practically just started complementary feed. Even your 7 months old, you just did complementary for 1 month. So if you have to try one new food for 1 week, that means at most in 4 weeks you've only tried four different kind of food, and you cannot say your baby has rejected all food just because of 4 food baby. There's so many options for the babies, and the way you mix the food and all those things, those are very important. So, and we already have these videos that's made by Global Health Media, and if you look at those videos, you will never see them use anything from the shops. They don't use formula. They use food that you have in your kitchen. The same food you eat every day. The same yam, the same pap, the same rice, the same everything you eat. Egg, fruits, all those things you eat every day. Those are the same thing you should give your baby. But the way you present it to your baby is a little bit different. The texture, is different. And of course, the way you mix them, different things. So we don't want to give baby pap and milk only. Or some of us, we don't even put sugar in the pap, because we worry that sugar is going to, I don't know what somebody has said about it. So you have to give thick pap. You can break egg into it and cook it with it. You can put a little bit of milk. You can put dates, something to sweeten it. And then you give, and it's small quantity. For a 6 months old, they just need like 50 mils, which 50 mils is like half a cup of like, for example, to give you concepts, your this tin peak milk that most of us use to measure things at home, that peak milk is 150 mils. 150 mils, that is what is inside. So if you want to give a 6 month old food, their baby just need to take about 1/3 of that quantity if you measure it with a peak milk. Or if you use your cup, some of us have this cup that already have graduation and all that, so 50 mils, that is the quantity that baby need to take at once. Baby does not need to finish a whole bowl of a whole bowl of 200 mils of pap. Just 50 mils, that is all. And then the rest should still be breast milk, and maybe at evening again another 50 mils. It doesn't have to be pap again. This time around it could be potato, sweet potato, Irish potato, anyone you like, you mash it very well, add a little bit of, your crayfish, a little bit of your salt or seasoning, and a little bit of your butter. Those are the kind of things we should be giving our babies to eat. But some of us, we just want to give them pap, 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 or any of these cereals they sell in the shelves. And when babies don't take them, then we start getting upset. So I found that most of the time, the issue is us not getting the complementary feeding right, which is why most time I sound very redundant telling people, go and watch all those videos, go and watch those. Even this your amala semo that you have in your house with ewedu or okra, you can give to your babies. You put a little bit of Titus fish. Very lovely. Most babies will eat it. I'm telling you, most babies love those kind of things. So it is not all the things that they sell in the shops that we have to give to our babies for complementary feed. So, and we have to, I know it's a lot of work because each time you are cooking new meal, you are cooking fresh food, but it will pay in the end. And at the end of the day, the baby will be eating. But if we get them into all these bottle feeding them formula, bottle feeding cereals, then when we get to 1 year, we are now struggling because that's all they want to take. No, that is not complementary feeding. Okay. So please watch all our complementary feeding videos. Try them. If you try and you still struggle, of course, come and see the pediatrician, come and see the dietitian, the pediatric nutritionist who will give you support around. Some mothers need a little bit more support than the others, but we are there for you. But most of the time, you have to do the right thing first. Okay. All right, Nifemi, I agree with you. I agree with you. Just say one of them first. Thank you. All right, time is up. I need to go. Which other medicine have you given your 7 weeks old baby? I think the only thing you've told us now is this injection and this anti-malaria, unless there are other drugs that you have given that we are not privy to. Anyway, there's a question on Instagram. Okay, I'll take the question on Instagram. What is the remedy for infection on the scalp for which baby? It looked like ringworm, but it's spread on a large scale and it's clear. If it is ringworm, it's ringworm. Ringworm is ringworm. I think most of us know what ringworm looks like. And if it's ringworm, that is a fungal infection, and there is antifungal medication. Unfortunately, for fungal infection, they tend to be very tenacious and their treatment tends to be longer. They are not something we treat in 5 days. Most fungal infection, we are treating them for 2 weeks, 6 weeks sometimes. And most time we're treating them through the mouth and through the topical application like creams and stuff. So I noticed a lot of parents get frustrated with fungal infection because we don't follow our doctor's instruction. We don't do it long enough. So it is not just something they are going to treat in 5 days like boils. Most of the time we're treating them for 2 weeks, and for very stubborn one we're going 6 weeks. Yeah, and we have to give the right dose again, which is where parents, because most parents go, oh, it's ringworm, let me go and buy antifungal. But you don't know the right dose for your child, and you're not giving the right number of times, you're not giving for the right duration, and then that's why parents always get frustrated. But please see your doctor so that we can tell you the right dose and the right duration of treatment for the fungal infection. Yeah, what you described, Jida hem, what you're describing is like a fungal infection. And you need to see, you didn't tell us the age of this child, you didn't tell us how long it has been going on, you didn't tell us what you've done so far, but it's a fungal infection. You need to see a doctor. We need to treat it properly so that it will go away once and for all. I hope that's helpful. All right. Thank you so much, everyone, for joining me today. I'm so glad we're able to get back today and we're able to go on Instagram without me using my phone, because I always make my phone to eat up, and so that's lovely. If you still have any questions, please go to Ask the Pediatrician Facebook group. Our Facebook group is always open Mondays to Saturdays, and you can post your questions there and we are happy to answer your questions. Please be patient when you're asking questions. If your child is very sick, please don't leave questions and be complaining that we didn't answer on time. If a child is sick, please come and meet us in the hospital. Don't leave it on Facebook. Sick children must be taken to hospital. come and meet us at the hospital. But if you want to know, okay, like all these questions we'll be answering now, how do I feed my baby? My baby is not eating, or my baby is not sleeping well, or what is the side effect? Those kind of questions, yes, we are happy to answer that. But if your child is already sick, please come and meet us at the hospital and we will answer them. And if you want to support us, let me look for our, just for you to be aware that beyond what we do online, we also do a lot of outreaches offline. So we welcome you. This, we have a QR code for first aid. We have a first aid booklet. If you want to take our first aid booklet, it's available online. Feel free to scan the QR code and you can always go through what you do, what are the first aid. We take this first aid booklet to all our children in the schools, secondary schools, but for the parents, you can also have a copy at home. And if you want to support us, these are our account numbers. You can trust that whatever you give to ATP is going to go to support um, children in Nigeria. And we are obviously, now that we're 10 years, we're looking forward to raise a lot of money to do a lot more for children in Nigeria, because things like our children, we can do better by them. So if you want to support us, feel free to support us. If you're a corporate organization, you want to sponsor our programs, you want to sponsor ATP Live programs, please reach out to us on our WhatsApp number and we will get back to you. So thank you so much, everyone, and I'll see you again next week. August is breastfeeding week. So breastfeeding week is next week. So watch out for all our breastfeeding programs on Saturday. This Saturday actually. It's actually from the 1st of August to the 7th of August. It's every year. We all know it's breastfeeding week every year. So, and ATP, we are very pro breastfeeding. So, we're definitely going to be talking a lot about breastfeeding. So, and I'm going to be part of the Pediatric Association of Nigeria program on Saturday, 5 p.m. It's a free program for parents, for everybody. We're going to be talking about breastfeeding. So join us. I'm sure we'll share the link once we have the link. So I'll be part of the panelists. So feel free to join us. That one is sponsored by Pediatric Association of Nigeria, of which I am a member. So we will be talking a lot about breastfeeding, but also watch out for ATP breastfeeding week. So this is the period for you to watch all our breastfeeding videos. All that, we'll talk breastfeeding. So everybody has questions on breastfeeding. Next week, come and ask all your breastfeeding questions. It's breastfeeding week, and we will always continue to promote breastfeeding, because breastfeeding is the best for our babies for the first 6 months of life. So thank you so much, everyone. Thank you, Mary. Thank you for coming online to support me. That's one of our regional directors in Akwa Ibom, and I'm sure they are planning the outreach soon. All right. So thank you so much, everyone. We'll see you again next week. I'll be talking breastfeeding, but if you can join us on Saturday, also join us. Have a wonderful evening, everyone. And it is bye-bye from me. And thank you so much for everyone that celebrated ATP at 10. And we promise to keep doing more, and we look forward to celebrating more decades supporting the Nigerian children. All right. Have a wonderful evening. I just want to sign off. Where's my ATP? Yeah.